Today, the topic is pelvic health. You can see the pelvic floor. So it's a connection between the pubic bone or the front of the pelvis and the coccyx or the tailbone. This is a really important part of the deep core. And we have a special guest, Dr. Lillian Donner, Doctor of Physical Therapy. Hello, Lily, and welcome.
Thanks for having me.
I'm sure there's a lot more to pelvic health than just the pelvic floor muscle group, but I'm sure it's a big focus. Is that right?
Yeah.
Okay.
I mean, you don't need to get so much wrapped up in the individual muscles. That's my job. But there is some sort of bigger picture items that we can talk about that can be really helpful for not only directly to the pelvic floor, but just overall body back health.
What kind of problems can people experience if they have pelvic floor dysfunction?
Basically, there's super direct problems you can have. Continence is a big one, important for sexual function as well, and very important for the stability of your whole body.
Maybe there's people out there that are watching that might have some pelvic floor issues and they don't even know it, but they have pain in certain areas of their body. What could that be?
Whether or not you're able to control your continence. So if you're having any leakage, whether it's with urine or bowels, that could be a symptom of a dysfunctional pelvic floor.
Okay.
Direct pain in the area. So pain with a variety of things, including sitting during intercourse is a really common place to have pain, especially with women, but also with men, but even pain in other parts of the body, like the shoulder or the neck, and because it all has to do with the body as a system and how it works as a whole. So if there's something going on in that pelvic floor, it can directly influence other parts of the body.
What about something like tailbone pain?
Definitely. So the pelvic floor, the muscles that attach in the pelvic floor, there are a few that directly attach to the tailbone. It could be anything from a subluxation or like a shift in where the tailbone is, and that can affect the muscles on either side. So for example, if the tailbone is shifted, say a little bit to the right, the muscles on the right are going to be very shortened and the muscles on the left are going to be lengthened.
So with I'm going to call it an imbalance in the muscle tension on the right and the left, would that be the cause of something like tailbone pain, or would that be more of a result?
So it depends on the situation. The time that it would be the cause of pain would be maybe after a traumatic injury or childbirth, or say you fell onto the tailbone and the tailbone actually gets shifted. You may have that muscle imbalance because of that. But the muscle imbalances may also cause the tailbone shift. Say you have a long history of doing something very asymmetrical, like you always cross your legs on one side, which some people are fine with, but maybe other times there might be people that are a little bit more sensitive to that asymmetry. And so over time, the muscles being tight on one side can start to pull that tailbone off to one direction, and then that can lead to further pain.
What about the relationship between the pelvic floor and breathing? How does that work?
It can be debated sometimes. So when you inhale, the diaphragm actually reverses its shape. It goes into this like U shape and dips down. That allows for the lungs to get more air in so that they can expand. So it needs room, right? That's why the diaphragm kind of goes downward. But at the same time, the pelvic floor has to accommodate for that distance. So the pelvic floor actually starts kind of in the opposite shape. And when you inhale, it should actually relax. So it goes into sort of that downward direction as well. When you exhale, the diaphragm actually rests. So it goes back up. That's its resting state. And when you exhale, the pelvic floor, it's not necessarily going to do like a full Kegel active contraction, but it's going to go more to its resting tone where it is going to contract a little bit and it's going to move upward. So you've got these like two dome shapes that are doing this every time you inhale and exhale. And it's all about maintaining a pressure system. The diaphragm is going downward, but then at the same time, you're trying to contract. So you're taking this deep, relaxing inhale, but then you're contracting your pelvic floor. That creates this pressure imbalance because you have one dome going one way and the other dome going that way. And it's just kind of pushing against each other.
So instead of them contracting at the same time, creating massive pressure, you want them to kind of work like a piston in a car, where they are coming up together and down together.
Exactly.
Okay.
And so one example I can give on proper positioning and techniques for bowel movements, I say instead of pushing and contracting, I actually want you to take a big inhale breath and relax the pelvic floor and see what kind of movement you can get through with that.
What to do with the pelvic floor when you're inhaling and exhaling? Ideally, if you can find that rhythm, it will become more natural and not something you actually think about. Is that right?
Yeah. And I actually give it as an exercise for many patients, 5 minutes a day, where they just either in lying down or sitting, work on that coordination. So you inhale, let the belly expand with air. It's kind of like that yoga diaphragmatic breath, but at the same time, really try to relax the pelvic floor. And then exhale, let the belly kind of shrink, and then feel just a gentle little lift of the pelvic floor.
Should we be doing a Kegel on the exhale?
The general answer is yes.
Okay.
And it's confusing for a lot of people because when we say diaphragmatic breathing, we say inhale, expand the belly. Well, most people are trying to make that very active. They're trying to push out their belly on the inhale, but it really should just be the belly filling up with air. So it should be a very relaxation inducing movement.
What do we want ultimately out of our pelvic floor? There's dysfunction where people have too tight of a pelvic floor and it's chronic. There's also the opposite where people have too relaxed of a pelvic floor and it's also chronic.
The truth is, yes, a majority of people do have some sort of weakness in their pelvic floor when they're having symptoms. But what a lot of people don't talk about is that relaxation portion of it, where there's this length tension curve. And so the longer a muscle can get in terms of relaxation and stretching, the more powerful it becomes. Let's think bicep, for example. If you're always focusing here, it's not going to be that strong. But if you work in that full length and then tighten, you've got that full power. I would say a lot of people are too tight and simultaneously weak because of that.
So do you notice a difference between men and women where like one would be more prone to chronic tightness or overly tight versus the other one?
It is more common in women for the reason of childbirth and pregnancy. I've seen it in men quite often, especially if they've spent a lot of time strengthening the rest of their body and focusing a lot on heavy lifting and sort of those like high power movements. It tends to affect that group of people that was focusing more on those like short, powerful movements.
So how do you know if your pelvic floor is too tight or if it's too weak?
A big sign is pain with intercourse, and they may have constipation because the pelvic floor is not relaxing at the time that it needs to. And they also actually might have urinary incontinence. The best way to know if you have a tight or too weak of a pelvic floor is to see a pelvic floor therapist, but those are sort of guidelines.
Do you find there's a relationship between emotions and feelings and the pelvic floor?
There was a study done where they actually hooked up electrodes all over the patient's body. It was measuring for muscle activity while they were looking at scary images. And the first thing to contract was the pelvic floor pretty consistently among everybody. What that told us was that when there is fear, the pelvic floor is going to contract first. Wow. And then the opposite of the spectrum is true as well. There are some recent studies that have shown dance and yoga actually helped relax the pelvic floor.
There are some yoga classes that are very passive, and then there are others that are more active.
Yoga is all about just staying present with your body. So if something doesn't feel right or it feels uncomfortable or if it hurts, you have to kind of stay present within yourself to know that that's not a good movement for you. And vice versa. If something is really feeling good, then stay tuned with that because you may want to repeat that movement later on another day.
Could getting the pelvic floor treated, like maybe by a physical therapist, could that actually help reduce anxiety?
I believe yes. A lot of how we think of organs, we think of everything with nerves kind of going one way. There's actually some electric impulses going the opposite way from the diaphragm. So what we can conclude from that is as we're working on that breathing and the diaphragm, we can actually send signals to other parts of the body. And so I believe the same can be true about the pelvic floor as we learn to kind of release some of the tension that we might be holding in that area. It can send messages to the rest of the body.
I think the pelvic floor is probably one of the, if not the most important and impactful muscle group that people are probably, as a society, we're the least in touch with.
Totally. Because the base is your pelvic floor, right? And so you've got this great strong can. You can't smash it when everything is intact. But you start poking holes in different spots and that thing just starts to crumble. And so the bottom of the can in Mary Massery's analogy is the pelvic floor. The walls are the spine and then the top is the diaphragm. So you've got a dysfunction in any of that, the whole system starts to collapse. I've had scenarios where I've had patients with shoulder or neck dysfunction that I couldn't figure out for months. And we started addressing their pelvic floor and it actually started to help their shoulder problems.
So I want to ask, what is the relationship between the pelvic floor and lower back pain?
I love that soda can example for that exact exact reason, because the walls are the spine. When you have any sort of defect in the system, it's going to affect the pressure of everything. And pressure is so important for maintaining stability. So if you've got sort of a weakness or a hole, that is going to affect the whole system. And so having that strong base, it's your foundation for the rest of the body going upwards. And I wanted to mention an actual physical connection with the abdominals and the pelvic floor. So the transverse abdominis is a really important muscle. There's actually fibers that intertwine from the transverse abdominis into the pelvic floor. So if I'm not able to do an internal exam, the first thing I'll teach is to get that transverse abdominis activated, because when the pelvic floor contracts, so does the transverse abdominis.
Nicola from Australia, she's having trouble with coccyx pain, also lower back pain, knee pain. She's about to have a coccyx injection next week. Is the pelvic floor involved in this? And is there anything else she can do besides the injection?
I would definitely recommend getting an evaluation from a pelvic floor therapist. Somebody needs hands-on to feel the muscular imbalance. They may be able to release the tight muscles on one side, teach some pelvic floor contractions as a whole to get it a little bit stronger. Also teaching the relaxation. There's techniques such as trigger point therapy, and it's basically like a hold right onto the muscles in order to get the muscles to release. There are a lot of options with a pelvic floor therapist besides the injections.
So how do you find a pelvic health specialist?
So the APTA does have a women's health section where you can search for therapists.
That's the American Physical Therapy Association, right?
Yeah. There's also Herman and Wallace, and then Pelvic Guru. So the way these systems work is if you're certified through their system. So it doesn't encompass everybody. And there are some therapists who don't go through the full certification, but still practice.
This is from Nicole Cisneros, and she is asking about the relationship between SI joint pain and these muscles. Do they affect the SI joint?
That is a huge indicator of a possible pelvic floor dysfunction. And the reason is, so the SI stands for sacroiliac joint. So it's the attachment of the sacrum, which is the middle bone in your body, like right above your tailbone, and the ilium, which is comprised of the two sort of giant pelvic bones. So what can often happen is one side of the pelvis of the ilium can sort of shift a little bit and create a little bit of imbalance from one side to the other. What causes that is either a muscle imbalance from maybe one side being a little bit too tight, or maybe some sort of big or even mini trauma, such as like stepping off a curb a little bit wrong, and you create this asymmetry.
Diastasis recti, is there a relationship?
That's a pretty common condition, definitely during pregnancy. So what it is the splitting of the abdominals. So you have your rectus abdominis. What can happen with pregnancy is it'll start to split apart just because of, the size of the growing belly. But after pregnancy, ideally, it starts to come back. When you have that splitting of the abdominals postpartum, now you have a hole in the system. Transverse abdominis is a really important muscle to activate to correct the diastasis recti. The transverse abdominis is also extremely important for the strength of the pelvic floor. So there is a direct connection.
How does cycling affect the pelvic floor?
Cycling's an interesting one because, there's a direct pressure onto your pelvic floor. Sometimes it's helpful to get adaptation to the seat, but then there's also sort of that added impact of cycling when you're sort of standing up and moving. Overall, I think cycling is a great activity. It's just a matter of whether you're having symptoms such as pain, incontinence, just generalized discomfort.
Should everyone get pelvic floor physical therapy, or where do you draw the line there?
In the perfect world, yes. But because access to pelvic floor therapists can be quite limited, I would say always go with a physical therapist you trust first. All physical therapists can treat the pelvic floor. I would say you get a lot more information when you start palpating the muscles internally, because there's muscles inside that area that function just like any other muscle of the body. They can feel tight. They can feel like they're not contracting when they should.
Beth wants to know if biofeedback works with this thing.
Yes, biofeedback's great.
Everybody kind of says do Kegels and Tighten, but sometimes you don't want to do that. Is that right?
Think of it as an elevator. There are 3 levels of this elevator we're on. So level 1, sort of your resting base. Level 2 is a little bit more lifting, a little bit more tightening. This is like, okay, I got to pee, but I don't want to pee myself. And then level 3 is that full contraction, like you're picking up something heavy. And then level 0 is full relaxation. Practice going within those levels. So try to go 0 to 1, 1 to 2, 2 to 3, and then drop down slowly.
So we do the bridge a lot in the program, and she was wondering if the pelvic floor should be engaged while doing the bridge.
So you can work on endurance with the pelvic floor. So you may be holding the bridge and do the Kegel contraction for a couple of seconds, release. You should be able to do a Kegel contraction without letting go of your glutes. That is amazing for coordination. I don't need to just squeeze my butt to perform a pelvic floor contraction. I can do this separately.
Does weight matter?
Well, it's all about control. If we have more weight than what we can control with our muscles, then it becomes an issue. There's no like specific ideal weight in my mind, as long as you have that muscular control.
The weight could potentially lead to something like prolapse as well.
So one of the functions of the pelvic floor is to act like a sling and kind of hold everything up. So as it becomes weakened, these organs, they start to descend, and there's different levels of prolapse. The most severe level, the organs will actually start to bulge outside of the pelvic floor. And those are pretty severe cases that are sometimes treated surgically, but there's also not so severe levels, levels 1 and 2, where that can be treated with just muscular contraction, such as pelvic floor therapy.
How do we know if we're doing the Kegel wrong?
One trick you can do, see if like while you're urinating, you can stop the flow of urine mid-pee. And if you're able to hold for a few seconds, then that muscle is working. You can get sort of the biofeedback where there are actually devices that you insert into your vagina, and you can check to see if the machine is picking up a muscle contraction. A pelvic floor therapist will also be able to check though if you're engaging too much of your inner thighs or your glutes.
Can you have a situation that Kegels actually are detrimental due to muscles in the area being too tight?
So again, it's that length tension curve. If you're always sort of in this contracted state, not only is the muscle not that effective and strong, but when it's chronically tight, just like any muscle, it can cause pain and discomfort. So what you really want to work on is that full relaxation in between the contraction.
I remember when I was in PT school and we had a guest speaker, and she showed us a way where we could kind of stretch the pelvic floor by sitting on a rolled up towel.
You can put up the rolled up towel and you just work on some anterior pelvic tilt where you're kind of arching your back a little bit, posterior pelvic tilt, maybe trying some shift side to side, and that's going to engage the pelvic floor muscles in different directions. And it's doing a lot more in terms of awareness than you think it is.
I would like to know how you would integrate strengthening and control of the pelvic floor with core training.
So say it's picking something heavy up. Well, where do you want the pressure to go? You don't want it to go in your low back, and you don't want it to go in your pelvic floor, but you want it to escape somewhere. So when you're exerting some sort of extra pressure, you're going to want to exhale. So I pick up that big baby, right? And you're tightening pelvic floor and the abdominals at the same time, and exhaling so the pressure is not getting stuck.
So is there any last words you want to say? Any final thoughts before you go?
I just wanted to say thank you so much for having me on here.
Well, thank you. And I hope to have more conversations about the pelvic floor. All right, Lily, well, thank you so much and have a great evening. Take care. We appreciate you here at Core Balance Training for leaning into your health, and we'll see you again next week.